I've given some thought to how neurophysio has changed over the years and what a neurophysio now might think about compared to myself coming out as a new graduate over 30 years ago. It's an exciting field. It was always a feeling of satisfaction one got from working in neurophysio, but it's even more than that now. It's absolutely an exciting field because of the advances in understanding the structure and the function of the brain and its influence on not only how we move, but how it governs everything we do in our life. And the 90s were the decade of the brain, and I think that this 21st century is going to be the century of the brain. And the explosion in understanding of the brain structure and function is just going to take us by storm. And I think we as neurophysios can capitalize on that. Not only are we going to understand in much greater depth and resonance the underlying structures, the pathology that leads to the impairments that we're working with, to the function that we're seeing with our patients, but we're also going to come up, I think, with much better predictive models of outcome for people who have neurological deficit or a neurological insult of some sort. This old adage that neurophysios spend far too much time on the wrong patients, which I think we still do to some extent, will be much more manageable when we can predict with much greater accuracy the kind of people that we need to be working with and where we need to be taking them so that they actually can achieve the things that they want to do, because we often fall short of that. So I think through the use of functional MRI and the NIRS and different PET and different imaging techniques available, we're just going to have a much more profound understanding. And of course the other linked to that, but the other really important, huge gain over those years has been our understanding of neural recovery, and both at a cortical and subcortical and peripheral level. I mean, we used to think, I was taught pretty much that the brain was hardwired, that the function that we saw in front of us, the residual function, was all we were going to get. We just sort of had to make the most of it. The idea of neurogenesis and recovery of the brain through all the mechanisms that we now know about was unheard of back then. And so again, we have the opportunity to find ways to harness this new knowledge and build it into our treatment techniques. We know a lot more about intensity of therapy, for example, and optimization of timing of therapy than what we did. We can gauge things in a much more accurate and useful way, and we need to apply that knowledge very much in our day-to-day clinical practice. So I think that there's certainly been huge advances in the knowledge that our body of knowledge that we can draw on. And of course the other area is the whole information technology and the use of IT to not only be able to learn from, disseminate information from, use it as a resource, but I'm also thinking as techniques within our therapy settings. The whole virtual reality practice is just going to take off, and I think that we're going to be able to harness that in our neuro rehab clinics. We're going to get to the stage of where implants and working with people with implants after spinal cord injury or post-stroke, they're going to become a reality, and we'll be very much part of the team optimizing the potential any person has for improving function. So these these are positives. I guess the negatives are the incredible pressure that we're under, the lack of time. Rehab is always going to be time consuming, and we're facing, shrinking inpatient hospital length of stays, and we're facing pressures to achieve outcomes in a pretty short space of time, whereas we know that if we had them for maybe another week or two, we could actually achieve something that was more meaningful. So we're going to have to find ways around that. We're going to have to probably do a whole lot more community-based rehab. There's a move towards that. There are positives and there are negatives for that, and the jury's still out on the evidence as to how, if that's more effective. But we have an awful lot of good things happening. I think we need to be lateral thinking in the way we approach problems. We need to make use of ourselves as consultants, I think, and make use of physiotherapy assistants as doing some of the daily grind stuff that just doesn't require high-level thinking, high-level clinical reasoning. We need to get over ourselves and actually, I think, devolve some of the responsibilities we have to people who don't have our level of training and skill, and actually use ourselves in a more consultative role, coming in and troubleshooting and then checking out, monitoring, rather than doing the day-to-day treatment. We may well end up with some robotic therapies to assist us in this way as well. But I mean, neurophysio as a profession, physiotherapy as a profession, I think has just got a huge amount going for it. I feel positive about it. I think that as long as we're adaptable and we look at the way health practices are evolving and we optimise what we can actually do, take from that and be there in the forefront, and keep getting out there to prevent us being marginalised. We need to have a good public voice, and we need to show our colleagues and demonstrate that we're actually up with the play.